And when people have a say or when they feel involved, magic happens, right? And I will tell you, particularly now, your listeners, I think, will agree, and I think you guys will as well. Healthcare has really kind of been a challenge here lately. It's really been, in my 30 years in practice, this has been one of the more challenging times. We're dealing with, reimbursement challenges, right? We're dealing with attrition and turnover of staff. We're dealing with staffing issues, it can affect morale on your teams, right? So, that becomes the foundation to a lot of the ways I leverage my position in the hospital is to try to, support people with that positive mindset, right? And remind people of your why we do this, right?
And, you know, it, we also see people, our colleagues of all sorts, nurses, physicians, who often sometimes will feel like they're not performing well or they're not producing or something happened where they had an incident and now their confidence might be a little bit shaken. It allows us to get into that space and do some of this work with them around shifting their mindset and helping them re-engage their why, helping them to understand that they have the preparation and the knowledge and the competency, and maybe it's just showing up being different in that space that will get them the performance that they need.
People feel more empowered when you give them opportunity to grow and to learn. So to use your example, there's an untoward event or there was some sort of issue. We have a great, like your healthcare system I'm sure does, we have a reporting thing. We actually every morning and morning huddle, we have an organizational huddle that we go over where we talk about striving towards a healthcare system where patient safety and patient quality are top priorities, of course, but also learning from our missteps, right? And taking away this punitive kind of feel to a mistake or an issue or an error and turn it into a learning opportunity, right? We rotate our departments that present to quality every month. And so I ask some of my providers to be the ones that actually present at quality, get them involved. Then they feel empowered to make change. And when people have a say or when they feel involved, magic happens, right? They're part of the system. They're part of the process. They're not just cogs in the wheel, right? So those are examples of how I try to get folks engaged and feel empowered to make a difference.